Before we jump into the episode today, I want to share something with you from my heart. First of all, thank you so much for listening to the podcast. I really can't tell you how much your support means to me. We've been doing the podcast now for almost 4 years. I can't even believe it. And I'm so grateful for each and every single one of you that listens, shares an episode with your friends, sends me a DM or a text message letting me know how an episode resonated with you or any aha moments. Seriously, I couldn't be more grateful to be able to create this podcast. It has been such a blessing in my life, and I love hearing the ways it's been able to provide value in yours as well. One thing you might not know is how much work it takes to be consistent with a podcast. In fact, did you know that the majority of podcasts don't make it past episode number 10? And we are well beyond that. And it's just a lot thinking of the episodes, recording them, editing them, managing the guests, making sure that everything runs smoothly and gets uploaded consistently and regularly. And so that's why I have created an amazing opportunity for you to support the podcast monetarily. And in exchange for that, you will get exclusive premium subscriber content. So for as little as $3 a month, you can become a premium subscriber of the podcast. And every month I will upload new voice-guided workouts and breathwork meditation audio for you. So that way you can work out with me, coaching you in your ears. You can also take a moment to reduce your stress and relax and come down and ground down with one of my breathwork audios. So if that is on your heart to support the podcast for as little as $3 a month to become a premium podcast subscriber, I can't tell you how much that means to me and the growth of this podcast. I appreciate you. If you're interested, click the link in the description, become a premium podcast subscriber, new content every month, and while supplies last, I'll send you an exclusive podcast coffee mug so you can have your self-love and sweat coffee every morning. I appreciate you. Now let's get into the show. Welcome to Self-Love and Sweat, the podcast, the place where you'll get inspired to live your life unapologetically, embrace your perfect imperfections, break down barriers, and do what sets your soul on fire. I'm your host, Lunden Souza. Hey, have you grabbed your free Self-Love and Sweat monthly calendar yet? This calendar is so amazing. It comes right in your inbox every single month to help you have a little nugget of wisdom, a sweaty workout, a mindset activity, just a little something to help keep you focused and motivated and keep that momentum towards your goals. So every day when you get this calendar, you'll see a link that you can click that will lead to a podcast episode or a workout or something that will be very powerful and quick to read. And then you'll also see on the top left corner of every single day, there's a little checkbox in the calendar. And what that is that's for your one thing. You can choose one thing every month, or it can be the same, something that you want to implement, and make this something that you can easily implement, like daily meditation or getting a certain amount of steps or water, for example, and staying hydrated, and even taking your supplements. This can be something if you want to get more regular doing a particular habit and routine, you can choose what that checkbox means. So if you want your Self-Love and Sweat free monthly calendar delivered right to your inbox every month on the first of the month, go to lifelikeLondon.com/calendar, fill out the form really quickly, and you will have your calendar in your inbox within a few short minutes. That's lifelikeLondon, lifelikeLondon.com/calendar. Go get yours for free and enjoy this episode. Welcome back to the podcast. Today we have such an wonderful guest, one I'm just so excited to not only let you guys hear and learn from, but also from my end too, just really to have a conversation with and learn more about this particular topic. So we have Dr. Dwight Jennings with us today, and he is an expert in jaw alignment and jaw orthopedics. And I was first introduced to Dr. Jennings through a friend of mine who is a patient of yours who is experiencing something that in most models of the world wouldn't pertain to what we think of when it comes to jaw alignment or dentistry or whatever. And so down the rabbit hole I went as my friend was your patient and just kind of shared a lot of the work that you'd been doing. I watched a lot of interviews and different fun things that you've done. And this is a space that I think, and we were talking kind of off the air before we started, that most people are not really thinking about or guided or taught, let's say, if you will, to think about when it comes to our overall health, this jaw orthopedics and jaw alignment. So thank you so much for being here, Dr. Jennings. I'll let you kind of introduce yourself a little bit more, and then we'll start the conversation with overall health when it comes to jaw alignment and what that means and potentially looks like for us.
Sure. So I'm a general dentist who limited my practice 35 plus years ago to jaw orthopedics, dental medicine, and pain management. So I've been doing precision jaw alignment for over 40 years and have come across a vast amount of medical literature explains why it's really important for a lot of aspects of health, both mental, physical, pain, digestion, immune function, just a lot of different areas. It has a very strong impact due to a peculiar way that the human developed. The jaw alignment sensors, what they call trigeminal proprioceptors, are the only sensory cell bodies in the brain. All of our sensory cell bodies for our eyes, ears, and skin are out in the ganglion, but your jaw alignment sensors are in the brain, and they're postured in the brain immediately adjacent to your sympathetic ganglion. So when there's bite dysfunction, it tends to put the body into fight or flight stress mode, and it tends to push up a neurotransmitter called substance P, something that most people haven't heard about, that most physicians don't know much about because there's no pharmaceutical remedy for it. But substance P is implicated as a primary driver in a very large amount of diseases. And what it basically does is it depolarizes cell membranes and lowers the voltage potential on cells, so cells fire too easily. So as your bite goes off and your substance P levels go up, then that would account for why most people get allergies, asthma, autoimmune disorders, and hypersensitivity syndromes. So my patients generally present with a hypersensitivity to noise and to light and hot and to cold and to food and to drugs and to stress. And as you become more hyperreactive, then you lose homeostasis, and people vacillate, oscillate, and get ill a lot more often than other people.
Mm-hmm.
So that's the nature of my practice and where I've been digging around for a long time, and we've come up with just a lot of very important information. Like substance P is implicated as to a primary driver in most forms of cancer. It's a major regulator of skin integrity, so it's typically involved in eczema, seborrhea, psoriasis, acne, rough skin. It is considered a primary driver in most mood disorders, anger, violence, addiction, depression, anxiety, said that. So they're likely not going to get very far on opioid addiction if the medical community doesn't look at bites. Bites have been degenerating on humans very aggressively for the last 200 years. They think it's due to soft diets. And every generation on studies around the world show that every generation is significantly worse than their parents. So we're degrading at a very rapid rate. And as bites degenerate, so is the health in general of the human condition. And I think that's a reason that we're just seeing a lot more degenerative disorders and chronic illness, that they're not really getting to the basis of why a lot of people are sick. And so this is a very common disorder. 50% of the population that's clicking and popping bites are typically most often the reason why people get into headaches. That's also a very common condition. and you open up cell membranes, that makes you vulnerable to viral infiltration. So we're going to see a lot more pandemics and epidemics as the human condition worsens.
Yeah. Oh my gosh, so much good stuff. And I think overall what I'm hearing is virtually nothing about teeth, what they look like, structure. It's like you're dealing with stuff that we typically would not go to a dentist or potentially seek this type of treatment for. And I think you said, autoimmune, asthma. I know you do a lot of work with like Parkinson's. You mentioned like just, maybe on a light end of the spectrum, or it could, be really annoying. Like you said, sensitivity to light or sound or things like that. So when your patients come to you, have they been like, Googling the heck out of solutions for their issues and then like stumbled upon, you? Luckily, thankfully, do you work with other doctors that know like, hey, this might be a jaw thing and I know the jaw guy, you know what I mean? How do people get to you? Because like I said, we're not taught to think those things as being like maybe the domino that knocks down other dominoes, maybe headaches. When you said headaches, I'm kind of like, okay, my jaw is close to my head. I can see how like even just like your bite can influence maybe your head or a headache. But all the other things you mentioned are very left field, I think, for a lot of us. So how do your patients find you? And are they like, oh my gosh, so grateful, right? I never thought this would be the solution. And here I am at the door of the solution, if you will.
Right. So a lot of get referred in because my patient base, they're pretty educated, but we do get doctors referring to us, and a lot of people do find me on the internet. We like movement disorders. There's literature. What's basically missing is that dentistry and medicine doesn't use artificial intelligence very well. That in artificial intelligence, we should be searching the literature for causation, and most doctors just go to the one or two things that they know. They throw their one remedy at it, and nobody's doing a broad search. And so when they start doing a broad search, then they'll come across some of the literature that I've posted and stuff. Like I had a patient I treated once, and she referred in her daughter. Her daughter had a constant cough for 2 years. She had seen 40 doctors. They'd tried steroids, inhalers, antibiotics, nothing. And when I examined her, we found that her 12-year molar had come in crossbite. And when we put a mouthpiece in her, the cough stopped before she walked out of the office. Right? And so cough, the irritability and the propensity to need to cough is a substance P phenomenon. And so it was as in asthma. So asthma is a substance P condition. But the medical community and the dental community just don't ever go there. Your dentist isn't taught how to assess jaw alignment. All primitive humans bit end on end, tip to tip, and most modern man has overbites. And there's biomechanical reasons why we need to bite tip to tip. There's reasons why we need to hit on the back teeth first. Hitting on the front teeth first makes you compress your jaw joints. That makes your temporalis muscle on the side of your head work harder, and that neurologically excites your trigeminal nerve. Your trigeminal nerve has 100 times more dense pain fibers than any other nerve in your body. So when this nerve gets excited, it puts a massive neurological load on the brain and brain function. It has a massive load on your reticular formation, your brain stem, your reptilian brain, and that's your center of sensory integration. So as bites go off, it affects strength, endurance, reactivity time. You just get into sensory processing disorders. People lose balance, equilibrium, vertigo, lots of musculoskeletal things occur. The Japanese have done 40 years of research on bite destruction in animals, and every time they shorten the teeth on one side on an animal, they all get scoliosis. Right. So the jaw alignment has a major influence on muscle tone in the back, or muscle tone throughout the whole body. I just had a lady come in. She had got TMJ pain, and her husband was a retired physician. And he happened to see that there was a connection between when he's looking up for a TMJ doctor, he noticed there's a connection between TMJ and Parkinson's. And so she comes in with right side body stiffness, rigidity, which is the primary reason for her Parkinson's diagnosis. But her left joint was severely compressed, which would normally account for that. So she most likely does not have Parkinson's and has been under many years of levodopa therapy improperly.
Mm. Mm. Do you, I know you've been doing this for a while, and yeah, like you said, people are becoming more and more educated and reaching out for solutions that allow for what you just said. Like, hey, maybe it wasn't just Parkinson's, maybe it was this. Do you encounter pushback because of that, controversy because of the way that you see this modality of healing? Like, I know that that's not stopping you, but like, what have you noticed when you're kind of hopefully at some point it won't be stirring the pot, right? That people will look in these directions, but you're a little stirring the pot, right? So like, what are people's reactions to that, Dr. Jennings?
Yeah, so most people are pretty disbelieving and they don't want to look at the literature, right? And when you show them the literature, when you present them with the, there's a half dozen articles on bite therapy for movement disorders, whether that's Tourette's, dystonia, torticollis, scoliosis, Parkinson's. There's medical literature on all this. But yeah, most people are fairly disbelieving because they haven't looked at the literature. Yeah, it is just a very, like, if you look at substance P, which isn't on anybody's radar, right? Under the National Library of Medicine, there's 26,000 plus articles on substance P.
Let's talk about that a little bit. Let's do like the substance P 101 for beginners version.
So substance P is a neuropeptide. It's 11 amino acid. And so it'd be like serotonin, dopamine, right? But there's no pharmaceutical to block it. So it destabilizes cell membranes. And so it's a major neurosecretory modulator. But when you depolarize cell membranes, then your hormones secrete differently. So typically with bite dysfunction, you see elevated people go into estrogen dominance, right? So there's a lot of gynecological dysfunction that you see. But substance P, when it gets secreted by pain fibers, it will make cells fire too easily. So that makes cells, if they fire too much and too easily, they'll die off. And so you get neurodegenerative disorders, but it's mostly the hypersensitivity that causes the main problem.
Got it. So they're super sensitive and then they're firing off, maybe like, for lack of better terms, just like doing the most, over exhausting. And then you have this degeneration. Is that what I'm hearing?
That's true. Yeah. So you get all kinds of hypersensitivity disorders, and pain. That's a hypersensitivity, right? Like in fibromyalgia, people react when there's nothing wrong with them. They get pain throughout the body. It's the elevated substance P. When you destabilize cell membranes, there's a calcium influx. It goes off calcium metabolism. You get osteoporosis, osteopenia, calcium influx. You get mitochondrial dysfunction. You get chronic fatigue. So there's a lot of things that start happening when the sensory system of the body gets disturbed. And medicine is missing a sensory theory of illness. Too much sensory input will make you sick, whether that's too much noise, too much light, too much hot, too much cold. And again, due to the high sensory density within the trigeminal nerve, it has a major effect on brain function and maintaining homeostasis for the human body.
Mm-hmm. Mm-hmm. Do you have kids? Do you have kids?
Beg your pardon?
Do you have kids?
I do. I have two.
Yeah. Okay. So the reason why I ask is because like when I think of jaw bite and alignment and things like that, I remember like being a kid and getting braces, and I had like these two teeth were growing like fangs over the top, and I never smiled until like after I got, like, you can see the journey of my school photos of like what my teeth might have looked like based on if I was smiling or not. But I remember I got like teeth pulled, I had an expander, I had like phases of dentistry and orthodontistry. I remember, I mean, I was young, so it's like my memory is what it is now, but I remember like the dentist saying that a certain amount of teeth should be, or the orthodontist, a certain amount of teeth should be showing when I smile. So that's why he was like widening the bite. And then for those of you listening, you didn't see me, but when Dr. Jennings was talking about where your bite should be, I was like doing the teeth on teeth one and kind of moving my jaw and mouth around. But the only time I ever heard about like jaw alignment or things like that as a kid was like aesthetically through orthodontistry or orthodontics because my teeth were super crooked. Do you get your kids braces? Do you think that modern orthodontistry, I don't know if I'm saying that right, but the modern orthodontics is like contributing to maybe some of the things you're seeing that maybe you're having to clean up a little bit? Does that make sense?
Yes. So orthodontics is structured to give you pretty teeth, but they aren't really taught how to functionally assess jaw positioning. That is, when you go to your dentist also never, for the most part, never checks to see where your jaw needs to be or wants to be in space. For about 10% of the population, their jaw wants to be into an underbite. That jaw wants to be so far forward that it puts them into an underbite. And so in those cases, when you're treating, you have to advance the upper front 6 teeth to such a point that you can get them to biting tip on tip. Orthodontists are taught that you should have a slight overbite, and that slight overbite is there because that's what most humans, that's average, that's what we think is normal. But functionally, it's not ideal in most cases. Most people, you can find that out, but if you just throw a popsicle stick between somebody's teeth and have them open wide and close on that popsicle stick and see where they go, that's usually very accurate at determining where it is that a person's jaw wants to be or needs to be when they just bite on that popsicle stick. But we're basically looking at the arc of opening and closing on the side, where the jaw swings in space. And you want that jaw to be able to swing closed naturally without having to either advance or retrude. In most cases, that jaw is being pulled back. Most people that have overbites, when they go to talk, their jaw jumps forward. Another criteria is that a person should bite and talk on the same trajectory. And so most people these days are born with the back teeth not quite tall enough, so they have to pull the jaw back to get the back teeth to touch. But when they go to talk, it'll jump forward on. So there's a hypermobility, which creates.
Okay. And is the idea that we don't want to do that? Like we want to have a jaw placement that's where we might rest and also how we might be talking, like so that you're not needing to, I don't know, change positions. Does that make sense?
Exactly. You're trying to get the hypermobility in function out of the jaw, trying to get it so it has to do the least amount of work to calm it down.
And people probably never realize that they're doing it, right? I can't imagine someone their whole life like, okay, shut jaw and now move forward because we're talking. It's just like movement that your body just does because that's how it's adapted to functioning with what you got, right?
That's true. Yeah, people born and raised, they never think about it. But when you bring that jaw forward and decompress the jaw joint, the cartilage reinflates. And so in about a day or two with appliances, they automatically are habituated forward. The joint gets decompressed, it reinflates inside, and so you get stuck forward, which then takes a lot of stress off the joint and off the jaw, posturing muscles, and the nervous system.
Mm-hmm. Yeah, so interesting. You mentioned that one particular client that had issues with coughing, and then after, a little Dr. Jennings magic, if you will, they were able to leave in that particular first visit with results. Is that common with people that you work with? I would imagine. I mean, yeah, you probably have variety, but is it more common than people would think that you get these like quick results? And are you surprised? Like, do you still have those moments? Or are you just kind of like, no, this is awesome and I know it works?
I do get those. There's actually on YouTube, there's a lot of videos of putting someone in a person's mouth and immediately stopping their movement disorders. So you can see tremors, dystonia, Tourette's immediately going away by just reposturing device. But in probably about maybe 50, 60% of the cases, you get an immediate result. There's another 30% that takes a while to back them back down to get the neuroplasticity shifts and stuff. And then there's a 10% that you have to work pretty hard to get them to respond, whether you're dealing with migraines or the jaw nerve, your trigeminal nerve, which is sensory to your face and teeth, controls brain blood flow. And so anytime people have a vascular insufficiency problem, which is 85% of strokes, TIAs and all that, the neurological community never, ever thinks about the trigeminal. I've never had a case in which they've sent them to their dentist or sent them to a jaw specialist to check out the bite as to why they might be getting transient ischemic attacks, fainting spells, cognitive dysfunction.
Why do you think they're not focusing on this?
If they sent the patient to the average dentist, the dentist wouldn't know what they were talking about. And so there's not a good body of dentists for them to be able to rely on to refer to. And the dental community hasn't stepped up. The dental community hasn't noted their important role. Orthodontists are taught to straighten teeth, not to align jaws. So the orthodontic community has not stepped up either. They're doing a little bit better these days since they're starting to look at airway. Right, airway requires you, but again, they're just bringing the jaws forward randomly and arbitrarily and structurally without looking at function. They're not doing it precisely. So you're going to see a lot of these airway cases where they bring the jaws forward that they're still leaving them structurally impaired. A lot of the jaw surgeries are the change in structure without going back and assessing function to see if they did it precisely, to see if the body can accommodate to their changes.
Yeah. And like, it's kind of like giving them maybe a one size fits all approach. I don't know, exercise or any program, but then not really taking the time to be like, okay, is this working? How do you uniquely like function in life and in the world? And how do we need to make some of those changes and adjustments? Do you think that's better than nothing? Or do you think that the precision is like the whole point?
Probably in most cases better than nothing. But like on young children, you're talking about the ortho angle. If you bring the jaw forward on young children, as the jaw comes forward, it bends back into the socket again. So you end up making the jaws longer. So both of my kids had pretty significant overbites. We started their treatment at a fairly young age, and it elongated their jaw enough that they were both able to keep their wisdom teeth. Right? So
okay.
Right. So that's part of the problem. As the lower jaw gets jammed back in the skull, it curls forward and it shortens the length of the lower jaw. So you see a lot more need for wisdom tooth extraction.
Yeah. I'm like thinking about my wisdom teeth and kind of the structure that you mentioned within the jaw of that curvature and why it makes sense that you wouldn't be able to welcome in those teeth and you would need them to get removed and changed. I had, only because I'm curious, I had my wisdom teeth out. I only had 3. I never had 4. In my early 20s, do you think that jaw alignment is better than having people consider wisdom teeth removal? Or do you think wisdom teeth removal is just like cool with the way things are? Or do you feel like some structural realignment could help us not need to do that? Hey, really quick, I want to interrupt the podcast for just a minute to tell you about one of my favorite supplements for hair, skin, nails, digestive, and gut health. And that is Snap Supplements Super Greens with collagen. Now, if you're following me on social media, you've probably seen me post about this a bunch because honestly, this product tastes amazing and it's jam-packed with nutrients, like I said, to support healthy hair, skin, and nails. It helps support detoxification, a healthy immune system, system, and there's even probiotics in there for a healthy gut. It's non-GMO, no sugar added, soy-free, grass-fed collagen, and every scoop is going to give you 7 grams of protein. And this is why I love it, because it's not like a protein shake. It's just a scoop of powder. It tastes amazing. I put it in water, or if I want more hydration, I'll put it in coconut water and mix it up. And it's like having a nice, refreshing beverage that's packed with a bunch of super greens and protein. So what I'm super excited about is that for listening to the podcast, you'll get this discount here, nowhere else, but for listening to the podcast. You can save 25% off on all your SNAP supplement purchases, including the super greens with collagen. And you do that by using code Lunden25 at checkout. That's LUNDEN 25. LUNDEN 25 to get 25% off at checkout. You can shop on snapsupplements.com, or you can shop on my website, lifelikelondon.com/supplements. And you'll see there's already an additional 10% taken off. But you, because you're a podcast listener, you're going to get 25% off when you use the code Lunden25 at checkout. LUNDEN 25 at checkout to get your SNAP supplements, super greens, and collagen, and all your SNAP supplements for 25% off. Now, let's get back to the show.
Yeah, I think structural realignment done at a young age would prevent that. Though there's just, as humans, we're getting genetically pretty impaired and compromised. So there's going to be a number of people that even when you treat them young, there's going to be enough skeletal degradation in their genes that they still wouldn't be able to keep their wisdom teeth.
Yeah, I just remember that being a very intense process. And I just, like I said, my whole life, my whole childhood, I should say, and still up into my early 20s, I just remember it like, let's pull this, let's link this, let's open this up, let's, just very interesting. And now learning all of this, it's just cool to know that this avenue could lead to relief in certain areas. I was watching, and I'll put a lot of links in the description and the show notes of this episode, but there's a lot of great stuff and interviews that you have on like just a simple Google search, and people have done Facebook Lives with you and been in your office, and you've been on cool podcasts and done a lot of things like that. And I heard you say something about smell restoration and the jaw. And I just thought that was so interesting. And I know there's so many, unique, specific, maybe ailments of rabbit holes we could go down. But that one was so interesting to me because I know that our sense of smell is also contributing to our taste. And so this could be like a whole new world of like sensory experience opening up for somebody. And I just think that's so wonderful. So I guess it's a trigeminal nerve and substance P thing, but what specifically and what adjustments have you seen to help people like, I can't imagine, I really can't imagine even just where I'm at now in Sedona, like just walking outside and experiencing just like the natural smell. It can be so, underappreciated. So what happens there in jaw alignment and smell?
So most doctors and dentists aren't aware that we have 2 noses. Our olfactory, first cranial nerve, everybody's pretty much aware of. But the chemoreceptors in our nose are part of our jaw nerve. And so multiple chemical sensitivity is going to be a bite dysfunction in most cases. All right. But the trigeminal nerve, where it innervates tissues, affects how tissues grow. So the research is that overstimulating the trigeminal nerve will alter how the skin grows on the surface of your eyeball. But it wouldn't affect just the surface of the eyeball. It would affect the tissues throughout the eyeball because that's the sensory to the whole eyeball. And so there's going to be a bicomponent to most eye diseases. Right? And so the same thing on smell, the sensory innervation to the jaw nerve, to the skin would affect ability to smell. So COVID is pretty much all about substance P. Right. And there's a couple of literature articles I'd be glad to send anybody that goes into explaining that. But substance P opens up cell membranes and allows viral infiltration. And so what's going to be happening in COVID is people have elevated substance P before they contract COVID. And due to bite issues or other things, they're going to still have elevated substance P after the COVID acute phase passes. And so they're going to get a lot of lingering substance P related disorders. It's like when people have bad bites and they get into a whiplash injury or a trauma, they can't heal from that trauma due to the constant micro trauma from the bite and the chronically elevated substance P. Substance P controls the collagen matrix, so the quality of collagen. It controls wound healing, stem cell differentiation. It would control, brain repair. And so there's just a lot of inability to repair and recover if your substance P levels are too elevated.
Mm-hmm. Are you working with patients who have had COVID and lingering effects and work with their substance P levels and their jaw realignment? And how has that been going in your practice?
Going very well. Yeah, we've
Cool.
done. Brings me back to where substance P. My interest in substance P came from was a lady I was treating for a whiplash injury. She was an auto accident, and she was having migraines. And we put her into appliances. And a year into treatment, she confided in me that she had 6 seizures a year all of her life until we put in our mouthpieces, and she'd got an entire year without a seizure. And I ran that by a physician that I was working with at that time on chronic fatigue and fibromyalgia. And he says, "Oh, you changed your substance P levels." That's where we started looking at substance P. That was over 25 years ago. So we found that we can dramatically impact substance P levels systemically with our bite therapy.
Nice.
So same thing on COVID. You can get a lot of people with post-COVID symptoms resolved. You can get those substance P levels lower. Quest is the only lab company that runs a substance P test, and their norms are not proper by their own admission. That what they put on there is normal levels. My suspicion is that substance P levels should be less than 250 microliters rather than their 1720, which they state on the test.
Okay, so we could go to Quest and do the test, but then follow your normal, let's say, parameters or regulations versus what you might see in the outcome of your test. Cool, good to know. Yeah, I'm a big fan of doing outside labs and things like that, and I know Quest, so I'll make sure I put that there in the show notes too. Okay, so 25 years ago. Let's go back. Substance P, like all this learning, excitement, where you're at now, were you expecting things to be where they're at now? Do you think the things should be moving forward? Are you between that moment you just described and what really let's say unlocked the door for you, how do you feel about that now?
It's a very slow process educating the medical and dental communities. Our pharmaceutical approach just doesn't lend itself to telling you have a structural approach. It's a hard, tough road to educate the profession. There is some big changes in the wind, I think, with the shift in looking at airway, and there's the oral systemic link that they're now looking at. They found a high correlation between oral diseases and a number of other diseases, whether heart disease or cancer or rectal cancer and all those things. And so it's going to be substance P that links those. They don't know that yet, but there are a number of people that are looking at the oral systemic link that I think will accelerate the focusing on this aspect of it. But by and large, neither the biological dentist nor the holistic dentist are doing precise jaw orthopedics. They're looking at dental materials and looking at root canals, looking at cavitations, but they haven't integrated precision jaw orthopedics as a part of their regimen. That's going to make a major power shift in what they can do for the public, for the holistic and biological dentists when they understand precision jaw orthopedics.
Mm-hmm. And I remember when my friend, working with you, the appliance, let's say, if you will, that you worked on with him and your patients, from my understanding, it's something that you invented and crafted and kind of figured out on your own. And then I remember being in your office, and then you go back and you take the thing and you like make the little tweaks and come back. Like, what's that trial and error been like? How did you have to be like, hey, you know what? Something doesn't exist out here that's doing this. I know what it needs to be doing. So I'm going to create it, and I'm going to like figure out how to tweak it and make it very precise. What's that journey been like of creating the solution for your clients or your patients?
So when you finally realize that there's a connection between a bite and a condition, then you work really hard at making sure you get rid of that condition. And that's driven me to come up with some creative appliances that aren't commonly used. Because we know that we should be able to impact a condition. And so the appliances that I use in my practice are a little unique. And we're currently in the process of starting to teach that process. We're offering upcoming classes in dental neurology and appliance fabrication, medical history integration, and trying to train a large number of dentists in dental medicine.
Cool. Yeah. I mean, we have to spread the word or make that ripple, exist beyond ourselves. And I would say, despite things moving, let's say a little bit snailish, if you will, and feeling like it's a little bit hard to nudge the medical space into a direction that you think is, a powerful direction. What's one thing for sure that you've like you left your stamp, you left your mark, no matter how slow things might move, like you're proud stamped? Is there something where you're like, yeah, that's cool, that's good, and I'm proud of that?
Yeah, we have over 100 cases of grand mal seizures that have resolved with our therapy. And so we have a very large, very, very confident that we can reverse seizures in most cases. And I think that's one area that really, that the alternative is to put them on anti-seizure medication, which impairs cognitive function, slows down their brain function. And
side effects.
Everybody all wants off the medication. And so this is one area that we've very well established. Recently we're looking at, on the other side of what we're just now exploring, is we're looking at a link between bites and Alzheimer's. And so the research is pretty clear that the nucleus in the brain that's primarily impacted in Alzheimer's is immediately adjacent to your jaw alignment nucleus. And so we think that there may be a connection as to how jaw alignment's impacting that nucleus function.
And just because I'm curious with what you know now in that particular arena, is there like a too late point when it comes to Alzheimer's that you're noticing? Like, is the sooner the better with some of these interventions better? Or like how, because I know people listening are, and I want to talk about that next, but there's a lot of people who are like, maybe, okay, I know someone or myself has this or this or this. Like, how do we get realistically excited about that solution?
Yeah, so that's a really forefront. I think so. There is some literature in which bite therapy has impacted Alzheimer's, but the person that did that research wasn't aware of the neural connections, and so they just said that they got it a little better and wouldn't understood why, and they weren't doing them to a precise degree that we would be doing. Right. So that's part of the problem. When you look at the research, they weren't doing the jaw therapy with precision. All dentists have their own model of what they think is ideal occlusion, and it's often not functionally ideal. So you have to read a lot of studies with a little bit of grain of salt and read into them that they could have been better. Like bite therapy is only 50%. The research is that bite therapy is only about 50% effective for tinnitus. And most likely it's because I think that the lack of degree of precision that they're doing in their bite therapy.
Nice. Cool. And for people listening that are having those aha moments or the, oh my gosh, that's me or someone I know, or yeah, the wheels are turning because like I said, it's like something that people might not have ever thought about before until now. Where do they start? Do you have a particular video that you've done in specific that you would recommend that like, hey, this is a good place to go? Do you recommend that they go to their current dentist and start throwing around substance P and trigeminal nerve? I mean, I don't want them to, people I think get excited. And then I remember I used to work at a supplement store and then it would be like, Dr. Oz said this was the thing. And they'd come pounding down that, they needed this. So like, what are our first steps to understanding if potentially jaw alignment and this restructuring we're talking about, this precision restructuring, could potentially be a solution? And like, where do they start? And also, like, are you the only person that does this? Are there other people in other places? You know what I mean? Like, so that people can start to like get connected if they need to or feel like it's helpful for them.
There's a fair amount of neurology that I know that's not common knowledge, but there's the International College of Craniomandibular Orthopedics, ICMO.org, is ICCMO, is a good place to start. There's practitioners that they do know how to do precision jaw orthopedics. And so that would be a good place to see if there's a practitioner near you.
To reach out and have someone that's like speaking your language already. Because I remember when I was going through hormonal confusion and I would go to my regular doctor saying things that I heard when I was learning, in other spaces, it was sometimes frustrating being the person being like, wait, but I heard this and I learned this. And then you go to where you think you're supposed to find solutions and answers. And they're just like, I don't know what you're talking about. I never learned that. So thank you for that solution so that people can go and maybe dig a little deeper. And I know I can think of some great videos of yours that I've watched on Facebook and YouTube and stuff too, that I'll link in the show notes so that people can continue to learn and grow and be curious about something. I think that's one thing I know for sure about a lot of the, let's say, rugs I've lifted up and whatever when it comes to health and wellness is just like stay curious, stay excited about the possibilities, because sometimes I'm sure you've probably had patients who come in who you just feel like frustrated and like I've tried all the things and whatever. And so, I'll definitely be sharing all the good stuff so people can learn more. Is there anything else you want to share that we didn't cover that you think is important for our listeners to hear today, Dr. Jennings?
I think one other thing that bugs me is that nobody even screens patients with psychosis for bite issues.
Mm-hmm.
Right? So in the last 5 years, there's a lot of medical literature linking substance P to mood disorders of all kinds. And it's like, we have this single psychotherapy approach to mood disorders that's needs to be modified. They need to open it up and again use a little more artificial intelligence approach and looking really as to what could be causing the mood disorders.
Mm-hmm.
So there's just a vast amount of medical dysfunction that we get into our pigeonhole approach. And then dentists, I'm pretty critical of my dental profession in that they haven't expanded their understanding. Right? TMJ is very poorly trained or taught in dental school. Right, and it's becoming such a major problem with modern humans. It's a very significant problem these days for most humans.
Yeah, it seems like you're very passionate about things that oftentimes people feel trapped in, and you're like, wait, this is not the end, or the way we've been treating it is not the most efficient. Right. And you said, yeah, it bugs you. It bugs me too. Now that I know more. I think it's so promising what you shared. And I think it's cool to have a broader range of solutions for mental health, as you mentioned, and not feeling like we're pigeonholed into, one modality, if you will. And I know from my personal journey with mental health, it's nice to have options. It's nice to have options of solutions and not just feel like you're running and, trying it. Okay, let me try one more time. Boom, up against the wall. It's nice to know that research is being done in more areas than I probably could imagine to help support people who have struggled like I have, because it's nice to know there are a variety of solutions that can be explored. And in that curiosity space, I think with mental health, that's what's helped me a lot. I feel like we could do a whole episode on jaw alignment and mental health and mood and things like that. But what do you feel like is the most promising there in terms of mood disorders, like overall? Is it specifically with anxiety or depression or things that you're like really honing in on? Like, what are you, I don't know, like what's the exciting cutting edge area that you're excited about in that kind of space?
Yeah, we've had some really good responses on anxiety and depression. If you just look at the literature, there's massive amounts of literature now on substance P being a major modulator of depression. The locus coeruleus, your sympathetic ganglion in the brain, is immediately adjacent to your jaw proprioceptors, your jaw alignment sensor nucleus. And so when the bite goes off, it puts you into sympathetic anxiety, hypervigilance state. I had a 18-year-old girl, severe anxiety, severe depression. She was doing counseling every 2 weeks, multiple medications. Her jaw joints were severely back into her ear space. And when we put her into appliances within a month, she was totally relieved. Right? So you just get making radical transformation. And having jaw joints severely compressed it's not that uncommon these days. But the first sign of bite dysfunction is typically a lot of ear infections in infancy. And then it morphs and you get other problems as you age. They'll get more allergies, asthma, respiratory problems. They get more anaphylaxis reaction. As you get older, you get more headaches, musculoskeletal problems. As you get older, you get more autoimmune disorders. So it typically transforms, morphs with every generation. In the elderly, you'll see more neurodegeneration. The bite puts a major load on the body that typically leads to very high medical utilization. There's a Kaiser study showing people with jaw function had on average over 4 times as much medical healthcare cost as other people. And so it really pushes up healthcare costs in a lot of areas due to the hypersensitivity and overreactivity. Substance P controls gut motility. So you'll see intermittent constipation, diarrhea. We're quite effective at reversing Crohn's and IBS symptoms when there's a bite problem with them. So there's just very broad application.
Yeah, case study after like aha moment, or like you said, like, okay, mood, and then it was digestive stuff. And so I just...
They typically present with complex cases, right? They'll, medical history, they'll a real TMJ case, when they show up, they have, they'll check 20 different things wrong with it. They just have very high medical involvement.
Yeah. I mean, it's part of a key player. I think after our conversation, I just feel like it's like a whole new world, like Aladdin and Jasmine, you're just like on this. Yeah, it's cool. And that's what I love. And what my goal is with this podcast, and even just my own curiosity journey, is to like lift up the rugs we didn't even know we needed to lift up. And like you said, this jaw dysfunction is common. It's right. It's nothing like, oh my gosh, now there's something else wrong with me that I need to fix. It's just like being curious and getting to know a little bit more. And now knowing after listening today that there are cool modalities and solutions that maybe are not super mainstream yet, but that people can kind of get started. So, Dr. Jennings, thank you so much for your time today. I appreciate it so much. We've learned a ton, and I know this is going to be like the domino that knocks down other dominoes for listeners to learn and discover even more on this topic. So thank you so much for your time today.
It's been a pleasure. Thank you.
Thank you. Thank you so much for listening to this episode of Self-Love and Sweat, the podcast. Hey, do me a favor. Wherever you're listening to this podcast, give us a review. This really helps a lot. And share this with a friend. I'm only one person, and with your help, we can really spread the message of self-love and sweat and change more lives all around the world. I'm Lunden Souza, reminding you that you deserve a life full of passion, presence, and purpose, fueled by self-love and sweat. This podcast is a Hit Spot Austria production.